good idea for women to get eyelash extensions?
I think if you ask any eye doctors who takes care of ocular surface disease, if it's a good idea for women to get eyelash extensions, I think the answer will be overwhelmingly no.
But it is a huge trend around the world. You've written about it too. It's hard to kind of ignore what's going on, right?
Correct. So, so we would recommend against it because of the immediate complications, the potential long-term complications, and also real long-term damage to ocular surface. However, you and I both know millions, not just tens of thousands, millions of women around the world are using eyelash extensions, falsies, and all the different things that they do to their lashes. So is it realistic? No, it's not realistic. So then the next step is, okay, so what can these women do to take care of them? What are the basic things that they need to learn so that it does not turn into a more serious damage to their ocular surface, to their tear film?
So it's not the end of the world if you have eyelash extensions, but you do need to take care of them properly, right? What do you tell your patients?
Well, for our patients, we have these conversations daily with our patients because on average, I think I see at least one or two patients a day. Because we're in Houston, most women, like we all at least wear eye makeup, and a lot of women are walking around with lash extension in Houston. So I usually have the conversation. If it's a super mild case, like the patient I saw this morning, it's very easy for me to just give her a daily cleaning, a foam wash to keep it clean. Those I take care of the day of the exam. But it's more complicated cases. I actually invite these women to come back for a separate medical exam visit where we capture the baseline photos, what the tear film looks like, what the meibomian glands look like. I'm actually going to look for underlying infections, inflammations, dry eye disease, and to take care of it and teach them how to take care of it so that it does, if it's already at the disease state, we get them out of disease state. And if it's at the symptomatic stage, we get rid of the symptoms, but in a proper way, in a long-term, much healthier way to protect their eyeball surface. So that's why I call it stage 1, 2, 3. So a woman who have red eyes, eyes are burning, all kinds of dry eye symptoms with half demodex, and who have meibomian gland dysfunction, that's what we call the stage 3. But for those women, actually, it's not as difficult because they have the symptoms, they're miserable, they want me to do something, right? But then what they really care about is, oh, okay, please don't take away my eyelash extensions. So it's case by case scenario. So we do have options for women to grow their natural lashes to get it longer, but that takes time. It's not as immediate. But there are some patients I actually tell them, no, you cannot get eyelash extensions again because they're actually losing their own lashes, right? Like, because the worst case scenario would be their own lashes are permanently gone, that we can't even grow them back. So there are a couple of cases, but hopefully we catch them here so you never even get over here.
What should people be doing every single day when they go home, take their makeup off? What is the best care routine?
The best care routine, step number 1, keep the lids and lash margin clean. So for example, all of us brush our teeth at least twice a day. Many of us brush more than that, right? So with our teeth and dental care, what do? We have to brush, we have to floss, and we rinse. So for the lids and lashes, step number 1, if they wear makeup, take off makeup on a daily basis. Should not go to sleep with makeup on. And women with eyelash extensions, because a lot of these women also wear makeup on top of that, so they need to take it off properly. And with people with eyelash extension, I actually give them a special, I call it eyelash shampoo, because I just assume they have blepharitis, which is the very basic symptoms. But I gave them a very specific foam wash, and these are the foam wash that's safe because it's safe for the glue, because you don't want to melt the glue, then the lashes come off, because these women are very concerned because they're thinking, if I lose a lash or two, that's $50. So I put them on a very basic lash cleaning, like a cleanser. It's a safe cleanser, and also give them a prescription spray. Mm-hmm. It's a hypochlorous acid spray so we can prevent things from happening. It's actually pretty easy to use.
But in the meantime, keep your eyes clean, dry.
Correct. So keep them clean. And then also a lot of these women have dry eye symptoms, so I actually put them on a preservative-free eye drop, like just a non-prescription preservative-free eye drop, so this way they're not going to the store buying something that has a lot of preservatives in them, and they just use whatever that they feel like, okay, this may work, or the worst thing to do is for them to go buy a eye drop that gets the red out, because those have preservatives and has vasoconstrictors. Then it perpetuates the problem. Yeah, so step number 1, keep it clean. Step number 2 is, depends on what the symptoms are. Is it how's the meibomian glands, how's the tear film, what do the lids and lashes look like? Actually give them specific treatment.
Okay, all right. But for the basic person with eyelash extensions,
yeah,
walk me through that. Keep them clean. What else? Don't wear a lot of eye makeup. Those basic tips.
The basic tips, because a lot of these women do wear makeup. Okay, so basic tip, keep it clean. So keep it clean. What does that mean? What do you use? So they can use what they use to take off the makeup. But that's a whole new conversation, because the preservatives in what they use also makes a difference.
Keep it basic for me though. You're at home, you have eyelash extensions. What am I doing to make sure that I don't create any problems?
Okay.
Wash, keep it clean, what else?
Putting some over-the-counter preservative-free eye drops, so to prevent your eyes from getting dry. So wash, preservative-free eye drops, very basic.
And that's good to go for just basic maintenance.
That's a very basic maintenance. Actually, very important. If for any women who plan to have eyelash extension, who actually have eyelash extension, so other than keeping it clean and use eye drop, get to know your optometrist really well. Make your optometrist your best friend, and go seek care at the first sign of red eyes, at the first sign of any discomfort, and at the first sign of any crusty discharge in the morning, and any itchy lids and itchy eyes.
That's a problem, probably, right? That's something coming.
So
all right.
that's something coming.
All right. And then what do you tell women as they go to have their lashes put on or to have them redone? What should you be looking for when you go to a lash studio? Like whether it's clean or just making sure the glue doesn't have formaldehyde or other weird things in it, right? Let's talk about that.
So for any women who do plan to have eyelash extensions, so it's very important where they get it from. Make sure it's a certified spa, it's a clean spa, and go online, look at their reputations, look at the reviews, and ask what they use. So the type of eyelash that they use, the type of glue that they use, and also pay attention to the person who's putting it on. Are they washing their hands? Are they alcoholing everything? Are they taking all tools that's autoclaved? Does the place look clean? Does it feel good? And what's their online reputation like? And also for the glue, ask, is this a glue with formaldehyde in it? Because that's a very common preservative in the eyelash glue, and that formaldehyde has its own host of issues that it will complicate things.
Dr. Lee, tell me, over the past couple of years, I'm sure you've seen an explosion of eyelash extension issues and what have you. Talk a little bit about that. Has it really been an uptick?
Yes, so the last several years we are seeing more and more patients with eyelash extension issues, because a lot of women, the longer they wear them, the higher the potential for, I call them ocular surface disease, because it's things on the surface, right? And a lot of these women have a multitude of issues. Rarely we only have one. Yeah. So for our practice, that's why we have actually very specific take-home instruction sheet for these patients of what they need to do. So the incidence is definitely going up.
Yeah. What is the worst case scenario? I mean, we're not trying to freak people out here, but there's definitely, if you don't take care of this, you don't see a doctor, there could be trouble.
Worst case scenario would be a permanent loss of eyelash.
That you can't grow back.
You can't grow back, and you can't even put any lashes on, because if you have no lash on, you can't have any to put on. Yeah, but we we actually have a blog on our website, Optique.com website that goes through this process, because we have been interviewed by radio stations, various TV stations. I write on this topic, and I teach eye doctors in addition on how to take care of these patients, how to have this communication, because all the eye doctors who treat ocular surface disease will tell any women don't do it, but the reality is they are going to do it. And then who's going to take care of them, right? The same with the eye doctors. But then a lot of these women want a quick, simple, want-something solution, but then that does not exist because it's a multitude of issues. So the key is for any women who plan to have eyelash extension, who have eyelash extensions, get to know your optometrist really well. And so we start at the basics, so we keep them here. We never even get to the more complicated cases.
I gotcha.
Yeah.
Is there ever potential to lose vision? Is there ever?
Yes.
Very extreme, right?
That would be very extreme. So the quality of vision is definitely affected, because for women with like what I refer to as stage 2, stage 3 complications, they do have what we refer to as dry disease or dry symptoms, because when the tear film is not healthy, when you don't have a smooth tear film, these are the women that they blink all the time. They have to really, because they can't see, the vision just fluctuate. The vision fluctuate several things, right? So the immediate reason is because the tear film is not stable. But one of the main causes is because the glands where the oil comes out, they're being clogged, okay? So the natural oil is not coming out. So over time, because we have women who have significant meibomian gland loss, that's another very serious long-term implications, is because we can't grow these glands back. Just like we can't grow eyelashes back when they're permanently gone, we cannot grow these meibomian glands back.
So you can lose your eyelashes, you can lose your vision, or
You
have
can lose
vision
the gland,
problems.
correct, and then you can have vision issues. So when the women go blind, no, they're not going to go blind, but the quality of vision is very poor. They don't have that clear, consistent, clear vision. It's just really frustrating because it affects their work. What do most of us do all day? We look at some sort of device for the line of work that we do, right? So imagine you have to blink and have to put drops in all day long just so you can work.
High
Well,
price for beauty.
Correct. It doesn't have to be there. So that's why there's a lot of education that needs to happen. And when people look at online, the last time I did the story, I forgot who sent it to me. There's a YouTube blogger actually did a homemade solution to take care of eyelash extensions, and I'm just like, oh my gosh. This is the kind of information that the general public, she literally had bucket, like she had water, she had Johnson & Johnson baby shampoo, she had all these, and just like, oh my gosh, it makes me cringe. I'm like, no, please, you're just gonna make things much worse. Yeah, so
Get
that's,
educated by a doctor.
Yeah, so that's one of the reasons I'm passionate about, right, so my education material toward the doctors versus toward the general public, because you got to keep it simple. You got to keep it to where people are, oh, this is something I can actually do. It's a product I can buy, and if I just use this, and then my symptoms go away. But then there's, when you go to the store, right, for example, dry eye symptoms, when you go to any of the big grocery stores, when you go to eye drops, okay, there are 20 bottles on the shelf. You're like, oh, meeny, miny, mo, which one do I buy? Okay, this one's on sale for $7.99. I'm just gonna buy this one. So that's why I said talk to your optometrist, because over-the-counter product do not have to go through the FDA approval, but depends on what they put into these product. So preservatives makes a difference, how the product is made makes a difference, and what's actually in the product makes a difference. So it doesn't, not everything is by prescription. There are actually a lot of stuff that's not prescription, but depends on what their ocular surface looks like. That's why you need a doctor to tell you what to use, so the problems don't happen.
Okay, I think we covered all of it, and very in depth, by the way. You clearly know your stuff. You've clearly seen a lot of these patients too.
I take care of these patients on a daily
All
basis.
the time.
All the time. In fact,